Welcome to our introduction on OB. Pregnancy, childbirth, and the potential complications of each are the focus of this lesson. Pregnancy is a normal part of life. It occurs daily as a result of ovulation and fertilization, things that we'll talk about as we go through our gynecology lecture. Most of these complications of pregnancy are uncommon. It's important to note that most of the time this goes absolutely normal. But when these complications do occur, you must be prepared to recognize them and quickly manage them appropriately. Complications such as hypertension or eclampsia may result from the pregnancy itself and result to the fact that the female patient is pregnant and the significant anatomical and physiological changes that occur to the body. We also know that in addition to this, such illnesses as diabetes or hypertension, cardiac disease, may also be exacerbated by the body's response to the pregnancy itself. There's a little bit of a different spin in that. In some cases, complications are the consequence of trauma, and we have to remember that OB is not just a medical emergency, but it is also potentially complications that can affect our trauma patients. Childbirth again occurs daily, usually requiring only the most basic assistance. Although childbirth complications do occasionally occur, we must be prepared for them, but we must recognize that the majority of the time things do go normally. That doesn't allow for us to have any room for the things that we need to know and to be on top of. These typical complications include things like preterm labor, multiple births, abnormal presentations, bleeding, significant bleeding, or any type of distress in neonate. And we'll go into more depth in regards to the neonatology lesson later. Those are just to name a few. Throughout this lesson, we will prepare you to assess and care for the female patient throughout her pregnancy, delivery, and then the first few moments of life with her child. Let's go ahead and get this lesson underway.